Hi, my name is Stacy Gavin, and I'm the exercise physiologist with Care Here. And today we're going to discuss some exercise myths and facts. Myth 1 is you will burn more fat if you exercise at a longer and at a lower intensity. Now, we would consider this a myth for several reasons, because one of the most important things that we need to consider when exercising is total energy cost, and not necessarily the longer duration at a lower intensity. Because when you walk faster, for example, you're gonna burn more calories per minute than if you're at a steady state at a lower intensity. So it's very important that we look at the total energy cost and not where we're getting our energy from, whether it's fat or carbohydrates. It's also more safer and practical to start at a lower intensity and then work your way up. But you don't necessarily need to spend hours at a lower intensity thinking that you're burning fat. So we want the most benefit out of our exercise. So if you can go a little bit higher intensity, you can shorten that duration and get the same benefit. Myth number 2, if you're not going to work out hard and often, then exercise is a waste of time. This is definitely a myth, because it's very hard to get a good 30-minute workout every day of the week, and we know that, and sometimes time just does not allow for it. So if you're able to get at least some exercise, you're going to get benefit out of it regardless of how long you're going. So we don't want this to deteriorate your exercise program. Research shows that even short bouts of 10 minutes of exercise during the day shows health benefits and a decrease in disease. Exercise myth number 3. Yoga is completely safe and gentle exercise. This is both a myth and fact. There are different types of yoga, and it's very important that you do your research before you actually take a class. And it's important that you get a good instructor that knows exactly what they're doing. Yoga is a great form of exercise. It's great for balance, it's great for coordination, and it's great as a stress reliever as well. But again, you want to make sure that you're taking a class from a qualified instructor and that you're doing the right type of yoga that's for you. Myth number 4. If you exercise long and hard enough, you'll always get the results you want. Now, we all know this probably from experience, but this is false. You also need to know that genetics play a big role when it comes to exercise. So you can't base your whole decision on whether you're exercising on the results. So you want to be able to get the results that you want, but exercising hard and long may not be what is right for you. Some people are just genetically different and respond differently to exercise. So find what fits for you, or talk to the exercise physiologist, and they'll help you out to design a program that best fits you and your lifestyle. Now, exercise is one sure way to lose all the weight that you desire. I would consider this a myth. Research has shown that actually diet plays more effect in weight loss. But the most important part of exercise is exercise plays the most important part in weight maintenance. So we want to make sure that we're not just using exercise without any diet alterations in order to lose weight. We want a good mixture of both. But it's very important that you start an exercise program early, so when it is time for that weight maintenance, once you've dropped the weight and you're ready to stay at that level for the right amount of time, that you have a good steady exercise routine already in place. And this will help with your long-term success for weight management. Myth number 6. If you want to lose weight, stay away from strength training because it'll make you bulky, or it'll make you bulk up. This is definitely a myth. Strength training doesn't necessarily make you bulk up. You can do a wide variety of strength training exercises that will be beneficial to your health and help with functional movement. Unless you're taking supplements or anything, it's not going to make you bulk up. We highly recommend strength training. The more muscle mass you have, the more calories you burn at rest, and the more independent that you're able to live as you get older. So we highly recommend strength training just for functional movement, mobility, and also longevity with the muscle that you have. Myth number 7. Water fitness programs are primarily for older people and exercisers with injuries. This is definitely a myth. I encourage a lot of patients to go into the water if they have any type of knee problems or if they just enjoy it. I highly recommend doing any type of exercise that you enjoy. You can get a lot of different exercises out of going into the water. You can do aerobic exercises with swimming and running in water. You can even do some strength training exercises with flotation devices and pushing them in the water and using water as a resistance. I know a lot of athletes that actually use water aerobics or water exercises as part of their base for exercise. So even though it seems like it's stereotyped as for older adults or people with injured, I highly recommend anyone that's able and that likes to get into the pool to definitely go in the pool and get some exercises. It's really great and it's safe as well, and great for your joints. Myth number 8. Health and fitness benefits of mind-body exercises like Tai Chi and yoga are questionable. This is definitely a little bit of a myth. There's research out there that shows that there are a lot of health benefits as well as low back pain. It helps with low back pain and fibromyalgia. You just need to do your research and select a workout and exercise that best fits you. Tai Chi and yoga are great for flexibility, balance and coordination, posture, stress management. So as long as you're doing it safely and again with a great instructor, these types of exercise definitely have their benefits. Overweight people are unlikely to benefit much from exercise. This is a myth. We all know that people that are a little bit overweight or people that are healthy always benefit from exercise, regardless of size or regardless of fitness level. The more exercise you get and even the little bit of exercise that you get will have gains in the long run. So it's great. A little bit of exercise, 10 minutes a day or broken up into 10-minute increments, lowers your risk for all-cause mortality. Both men and women will see great results and will benefit immensely from exercise, regardless of if you're overweight or underweight or different sizes. Myth number 10, home workouts are fine, but going to a gym is the best way to get fit. My recommendation is wherever you feel comfortable is where you should be. If you like the gym, you can definitely do the gym, and it has a lot of machines and available exercise equipment for you. If you're not comfortable going for the gym, there are a lot of home exercises that you can do that don't cost any money, and you don't have to worry about getting a gym membership. There's a lot of bodyweight exercises, band exercises, or any other type of exercises that you can do all at home in the comfort, in your comfort level, whether it be at home or in the gym. You can get just the same amount of workout and just the same amount of benefit from going to the gym as you can if you stayed at home and did an exercise program. So if you feel more comfortable at home, I highly recommend stay at home and find a home-based program for you.